Katerina Bajerova. I come from University Hospital in Brno, where I work as a pediatric gastroenterologist. I have an experience as a general practitioner in pediatrics too, and I'm a passionate user of CoMiSS. CoMiSS was developed by a panel of experts to increase the awareness and, in reality, not to overdiagnose and underdiagnose the cow's milk allergy. In fact, there exists a gap between a symptomatic infant and a suspected infant, and CoMiSS is the tool that might bridge the gap and help healthcare providers to decide whether the child is at risk of cow's milk allergy or not. CoMiSS is an easy-to-use awareness tool intended for infants under 1 year of age, which should be used by general practitioners or any healthcare provider. As soon as we have an infant suspected of cow's milk allergy, we perform the standard procedure like elimination diet 2 to 4 weeks without cow's milk, and then followed by a food challenge and a very close follow-up with seeing the patients repeatedly up to fortnight after the challenge was started. Of course, there are some situations when CoMiSS is not allowed to be used. The first one is anaphylaxis. This is a life-threatening condition, and in this condition an infant should be referred quite quickly to a specialized care. The other one situation is when the child doesn't gain weight correctly or presents with failure to thrive. As is known that not only cow's milk allergy may be the cause of failure, and also a sick child presenting with hematochezia or blood in stools is not the one who should be assessed with CoMiSS. How to use CoMiSS? When seeing an infant presenting with symptoms as excessive crying, atopic dermatitis, diarrhea, regurgitation, the absence of any type of infection should be excluded. The clinical examination should be done. The advantage of CoMiSS is that it reflects not only the presence of the symptoms, but also the intensity of each included symptom. To obtain the total score, you simply sum up the 5 symptoms subscores. Except urticaria and angioedema, the appearance and intensity of the symptom needs to be seen at least during the last week or 7 days. The first symptom to be assessed in the list of symptoms is crying. It's important to consider crying that was lasting at least 1 week or longer, and there was not present any obvious case of problems like high temperature, infection, any disturbances caused by situation in the family. So this is how we score the crying. The other item is regurgitation. Regurgitation is assessed in children, again, if it's lasting at least 1 week. It is considered how many times and what was the volume. Again, parents usually hesitate. It's important to help them find out how many 5 milliliters, what's the amount of 5 milliliters. It depends on the country. In some countries it is teaspoon, sometimes in other countries it's coffee spoon. Just consider what is obviously used in your country and then help parents to find out what was the volume. To assess stools, we use Brussels infant and toddler stool scale. The quality of stools should be present at least 1 week or longer. The same quality of stools. The stools are scored in 4 different categories. The first one is the hard stool, the other one is formed, the third is loose, and the last one is watery. It's easy for parents to assess the stools because they are made of photographs which are easy to assess. It's easy to recognize which type is present, and parents get quickly the proper and relevant type of the stool. What is important to stress out in this case, we should be aware of infections because loose and watery stools may be connected to infections. So always necessary to ask about temperature, about behavior, about the quality. No, don't mix up standard situation and infection. Different skin symptoms are assessed when CoMiSS is used. The first one is urticaria, the other one is angioedema. These two have only two categories, present or not present, 0 or 6 points. The other one is eczema. And to assess eczema, it's more sophisticated. For this purpose, you need the user's guide to see what surface was affected, how extended it was. It's not about intensity, it's about the surface. Please use the user's guide and check it once more. The last section of CoMiSS are those respiratory symptoms. They are a bit outstanding because they are not weighted as well as the other ones. They can be caused also by a viral infection as well as by cow's milk allergy. For this purpose, a maximal score of 3 is for the worst symptoms like wheezing. On the other hand, chronic cough is scored by 1 point and runny nose by 2 points. Obtaining all count for subscores, it's necessary to count down the whole score of CoMiSS. In the end, you have 3 different scenarios. The first one, you have a score 10 and higher. At this situation, you just start with elimination diet. You exclude cow's milk either from mother's diet if the child is breastfed, or you use a special formula for allergic children and keep this diet for 2 to 4 weeks. After this, you follow by oral food challenge and check for symptoms typical for cow's milk allergy. This is the only way how to diagnose cow's milk allergy in practice. The other scenario is your score is quite low, below 6, and you see this is a physiological value and you don't have to do anything. Just calm down parents that those symptoms are not relevant and take care of the child as you usually do. Finally, the total CoMiSS score may range from 6 to 9. In this situation, you just monitor the child and you will see. If it aggravates, you just go ahead with examination, and on the other hand, it's possible he will get better and no intervention will be required.